I'm Dr. Monia Dent. I'm an OBGYN here for Riverside Partners Women's Health. I practice in the Oyster Point location as well as in our Gloucester location. You want to know if the vaccine, the COVID-19 vaccine, is safe in pregnancy for patients that are trying to achieve pregnancy, and then also for breastfeeding or lactating women. It's a little bit of a pointed question, I guess, in a sense. Is the vaccine, of course, is a newer vaccine, and currently right now in the U.S. there are only two vaccines that are available. That's Pfizer vaccine and the Moderna, which are both messenger RNA vaccinations, which are newer vaccinations to the U.S. market. So there isn't, unfortunately, a lot of long-term data. But the data that is out, that's been studied in both large groups that studied over, tens of thousands of patients before they came out and were utilized in patients, show that the vaccines are safe. They unfortunately aren't studied in pregnant women, and that's the case for most medications and all vaccinations that we currently administer to patients and give to patients. So knowing if it's safe in pregnancy, unfortunately, it is unknown. But ACOG, which is the American College of Obstetricians and Gynecologists, as well as a group of high-risk obstetric providers, which are referred to as the Society of Maternal Fetal Medicine, have all come in agreement and said that we should not prevent patients who do meet criteria to receive the vaccination for various reasons, whether it's comorbidities and the like, from receiving the vaccination. In pregnancy, women unfortunately are more at risk of developing more severe cases of COVID-19, requiring ventilation, ICU admissions. There's also some data that it may actually increase chances of preterm delivery. And so, of course, if patients have other comorbidities, they're overweight or obese, they have hypertension, diabetes in pregnancy or outside of that, those things as well can significantly increase their chances of having more significant or severe disease. And so for those individuals, the risks of developing severe disease from COVID outweigh any potential risk that there may be to receive the vaccine, and so it is still recommended in those individuals. Of course, as more data comes out and more pregnant women choose to become vaccinated, I know that both sort of companies that have created that are continuing to follow that data. And so, as we know, COVID's a new virus, and there's a lot of things that we don't know about it, unfortunately, but we're trying our best to keep all of our patients safe and healthy as much as we can. In regards to that's the same that goes for women who choose to breastfeed and receive the vaccine. There isn't any data, once again, to kind of show. There were a few women, I think, in that who were breastfeeding. There's just not enough data to say whether or not it's safe. But there is no virus that's being transmitted to the patient through the vaccine or through their breast milk. So, you're not going to give your child COVID-19 by giving them breast milk. There may actually be some benefit in that as you create antibodies against the virus that may actually transmit through the breast milk, just like it does for any antibodies that you create in the beginning stages of pregnancy in your colostrum, which is those first weeks of breast milk that you create that are rich in antibodies. So the thought is that you may actually be helping your child by giving them antibodies that are also transmitted through the breast milk as well. I myself am a breastfeeding mom. I just had a baby about 5 months ago, and I received the Pfizer vaccine without any sequelae or issues, and I'm still giving that baby breast milk. So hopefully, that has some benefit. And there actually are some studies that breastfeeding women can enroll in where they're following that. I'm also doing that as well. So there are some residency programs nationally that are looking at studying those women and following them along and seeing what kind of outcomes may come out of that. There's also been a lot of information about fertility and does the vaccine impact fertility in a negative way. There's also no evidence to show that that's the case. There actually, I think in the Pfizer's group, there were actually a few women who shortly got pregnant after, or maybe inadvertently were pregnant and unbeknownst to them, and there haven't been any negative impacts for those groups of individuals. Once again, it's small numbers, but just the science of the vaccine doesn't indicate that it should have any impact on your ability to conceive. It doesn't affect your DNA, doesn't alter your DNA. It doesn't do any of those things, and I know there's a lot of misinformation about that. That's just not how the vaccine works, the science behind it, and so there's no information to suggest that it should impact your fertility. And honestly, if you fall into those high-risk categories, it probably once again behooves you to have the vaccine administered before you achieve pregnancy, so therefore you don't fall further into a high-risk category where you could have more severe COVID if you are pregnant and then obtain COVID at that time. So I think those groups of individuals that fall into those high-risk categories, once again, are great candidates to receive it, just to be thinking about how they can prevent severe disease if they do achieve pregnancy shortly thereafter.
Thank you, Dr. Dent, for that comprehensive discussion about the COVID vaccine. I am Dr. Lisa Casanova. I am also work for Riverside Partners in Women's Health at the Oyster Point office with Dr. Dent. We are happy here to be able to answer some of your questions and discuss the COVID disease as well as the COVID vaccine. I was just going to kind of reiterate some of the things that Dr. Dent said and maybe add a little more information. I think the decision, is the COVID vaccine available to pregnant women? Yes, it is available. And as Dr. Dent said, we do not want to withhold that vaccine just because of a woman is pregnant. It certainly is available, but I think that decision should be individualized between you and your healthcare provider. We do know that COVID-19, the disease can be more severe in pregnant women. So in other words, if you're a 30-year-old who's pregnant and you get COVID, compared to a 30-year-old who's not pregnant and gets COVID, the pregnant woman is likely to have more severe disease, have to be admitted to the hospital, perhaps have to be on oxygen, and admitted to the ICU. So more likely when you're pregnant than when you're not pregnant. The overall risk still is low for those serious problems, but it is more likely when you're pregnant. And then, as Dr. Dent said, you have to take into consideration the other aspects of your health. For example, do you have high blood pressure? Do you have diabetes? Do you have obesity? Those are other risk factors that could make COVID-19 more severe. So in that case, you may be leaning now more towards, okay, I should get the vaccine because I have these risk factors. The other things to consider would be, what is your risk of exposure? Obviously, if you're a frontline health care worker like Dr. Dent is, then your exposure is going to be greater, and that may persuade you to get the vaccine, versus if you're a stay-at-home mom working from home, no other kids at home, nobody's coming and going, and you're not out there getting exposed, you may say, I'm a little bit safer, my risk of getting COVID is less, maybe I'll sit tight and not get the vaccine until after I deliver. So you have to take those other things also into consideration. In terms of vaccines in general, most vaccines that don't contain the virus or part of a virus are safe. The COVID vaccine does not contain any live virus, as Dr. Dent said. So it is safe. The other viruses that we typically give during pregnancy, such as flu or Tdap, those do not contain live virus, and those are safe. There's only a very few vaccines that are not safe. Varicella, which is chickenpox vaccine, is not safe during pregnancy, and measles, mumps, rubella, which is also a live vaccine, is not safe during pregnancy. But in general, most other vaccines are safe, and the benefits outweigh the risks.